Hello everyone, welcome to our channel at Anaesthesia Pulse. In this video, we will understand the laryngoscope and its part in detail. Now, what is a laryngoscope? A laryngoscope is an instrument which is used to visualize the larynx and the vocal cords to allow placement of an endotracheal tube into the trachea during anesthesia and emergency airway management. Now, what are the parts of the laryngoscope? It has a handle and it has a blade. The handle, it is the cylindrical part of the laryngoscope. It has two 1.5 volt batteries which give power to the light source. The surface is rough to get a good grip. The upper end is slotted and it has a hinge pin into which the blade is attached. When the blade is attached to the handle, they form a right angle, as you can see. Now the blade is the part which is inserted into the patient's mouth. It is used to depress the tongue and to lift the epiglottis to allow visualization of the vocal cords. A blade has certain parts. It has a tip, it has a tongue or the spatula, the flange, the web, the bulb or the light source, and the base. Now we will discuss each part in detail. Tip is the distal end of the blade. It is blunt and thick to prevent trauma to the soft tissue during use. Tongue plate or spatula. It may be curved or it may be straight. It is used to manipulate the tongue soft tissues to visualize the larynx. Flange. Flange, it is parallel to the spatula. It is the curved side wall of the blade and it is used to sweep the tongue to the left to create a clean line of sight to the glottis. Web. This is the web. It connects the tongue with the flange and it provides strength and structural support to the blade. The light source or the bulb. This is located near the distal end. It has an electrical connection to the hook on the base. When the blade is locked with the handle, the electrical contacts gets complete and the bulb is illuminated, as you can see over here. Base. Base is located at the proximal end. It has a hook or a mounting slot to engage the hinge pin of the handle. Now, what are the types of laryngoscope blades? There are two types of laryngoscope blades, the Macintosh and the Miller's. Macintosh, as you can see, it is a curved blade. It is flat on one side and rigid on the other. It is Z-shaped on cross section. It is used in adults and the tip is placed in the vallecula. It lifts the epiglottis indirectly. This is the Miller's blade. It is a straight blade. It is curved like a half cylinder and flattened at the distal end. It is C or U-shaped in cross section. It is used in infants and children and it lifts the epiglottis directly. Now the laryngoscope blade, they come in various sizes. Macintosh, size 0 for neonates, 1 for infant, 2 for child, 3 for adult and 4 for large adults. While the Miller blade starts from size 00 for preterm infants, 0 for neonate, 1 for infant, 2 for children, 3 for adults and 4 for large adults. Now sterilization. The blade comes in direct contact with the patient's mouth and secretions, so it needs proper cleaning and sterilization. Now, what are the steps? First is you wash with detergent and water, remove the blood and secretions, and sterilization is done by autoclaving, glutaraldehyde or hydrogen peroxide plasma sterilization. Now, what is the position for direct laryngoscopy? It is sniffing the morning air position. The patient is supine and there is flexion at the neck and extension at the atlanto-occipital joint. The head is elevated with a pillow or a ring to align the three axes oral, pharyngeal and laryngeal. The laryngoscope is held in the left hand and is introduced through the right side of the mouth till the epiglottis is visualized. After that, it is advanced into the glossoepiglottic fold and lifted upwards and forwards like this to view the glottic opening. It should not be used as a lever with the upper teeth as fulcrum, or the larynx will be pushed upwards out of vision and also the teeth will be damaged. Now, what are the complications of laryngoscopy? They include trauma to lips, tongue and soft tissue, damage to teeth, bleeding, circulatory changes like tachycardia or hypertension, and fracture dislocation of cervical vertebra if extensive force or manipulation is used. So, in conclusion, laryngoscope is a vital instrument for airway management, and all medical and anesthesia students should be proficient in its use. Thank you, and follow for more anesthesia pearls.